Charaka defines Vamana as Tatra Doshaharanam Urdhvabhagam Vamana Sabnyakam, that which eliminates the impurities from the upper part of the body is known as Vamana. Vamana or Emesis is the first in the series of treatments aimed at removing the vitiated doshas from the system. As we are all aware, Kapha is the dosha that occurs first in anything to do with the living body. In childhood, Kapha is the most prominent dosha and is primarily associated with the building up or constructive process or growth that takes place. In the course of a day, Kapha is predominant with the beginning of sunrise and the beginning of sunset. During the digestive process, Kapha is predominant in the first stage of digestion. And if we look at the erect human being, Kapha is prominent in the upper part of the body, that is, the space above the chest region. When this Kapha is vitiated, the most important treatment that can be given is the emetic process, which will enable the vitiated Kapha to be thrown out of the system. In fact, Vamana is not aimed only at dispelling the vitiated Kapha. It also enables correction in conditions where Pitta occupies the place of Kapha or in a Vata predominant Kapha state. The medicines used for the Vamana we are about to show you are 3.5 grams Vacha or Acorus calamus and Yeshti Madhu or Glycyrrhiza glabra, Madanaphala or Randia glumatorum 7 grams, 2 grams of Saindhava or rock salt and ½ gram of rock camphor. All of the above are together made into a paste with honey. The patient should be first made ready for the treatment by giving him the oleation and sudation therapies which were described earlier. Preferably, the patient should be given a course of snehapana or intake of medicated ghee or clarified butter for a period of 7 days, commencing with a small dose and then gradually building up till the 7th day, by which time the body will be suitably uncted. On the 8th day, the patient is given the prescribed sudation therapy. Then, the night previous to the administration of the Vamana, the patient should be given milk or curds or eatables prepared with black gram, sesamum, oil cakes or green vegetables added with large quantities of water. This is given to excite and increase the Kapha in the body. The next morning, when the food of the previous day is found to have been well digested, the patient, having offered his prayers, should be asked to sit facing east comfortably on a chair. He should not have taken any food. Then, milk should be given to drink in sufficient quantity till the patient is full right up to the throat. Normally, a liter of fluid is given, which may even go up to a couple of liters depending on the individual patient. Then, the drug to produce vomiting should be given to him, made warm and mixed with honey and rock salt. If required, more milk can be given till the urge for vomiting arises. When the urge to vomit arises, the attendants should hold the patient's flanks and forehead firmly and give mild massage in the upward direction over the back and calm the patient. The patient should keep open his lips, palate and throat, and when the vomiting has commenced, the patient should bend just sufficiently to bring out the material. The bouts of vomiting should be allowed to continue either till the Kapha is expelled out or the medicine administered comes out or till the Pitta comes out based on the assessment by the physician. If the vomiting is inadequate, the bouts should be induced further by drinking warm water containing a paste of pepper, mustard, salt, etc. The quantity of vomited material collected in the receiving vessel each time should be noted. Generally, emesis occurs till the appearance of pitta in the vomiters or the elimination of the entire kapha. Pitta can be known as a brownish yellow sticky material. The person who has had Vamana adequately should wash his hands, feet and mouth, take comfortable rest for about half an hour and then take an inhalation of medicated smoke according to his capacity. Wash once again with water and sleep on a cot inside a room devoid of heavy breeze. Then, taking note of his digestive capacity and appearance of hunger, either in the evening of the same day or the next day, he should take bath in comfortable warm water and take food prepared from old red rice, boiled well, without mixing it with ghee, salt and pungents, or mixed with very little quantity of these substances, liquid in consistency, and followed by drinking of warm water both in the afternoons and mornings. He should also adhere strictly to the regimen of taking liquid foods twice a day for 8 days, 5 days or 3 days respectively, based upon the extent of vomiting that he has had. The principle is that he will move slowly from very thin gruel on the first day to very thick gruel by the last day. The symptoms of properly done emesis therapy are the proper expulsion of kapha, pitta and vata in succeeding order at the proper time, quantity of the vomited material not being very large, coming out without much discomfort, bouts coming up and subsiding of their own accord, clarity of mind, purity of the voice and absence of symptoms like loss of appetite. As is told for every treatment, the diet and lifestyle restrictions are to be strictly followed for the prescribed duration after the treatment in order to get the maximum benefit. Vamana treatment is indicated in conditions of poisoning, indigestion, acute fever, tuberculosis, diarrhea, insanity, epilepsy, bronchitis, asthma, diabetes, skin diseases, anemia, obesity, rhinitis, tonsillitis,